I'm Dave Breakenridge, and this is Under the Dome. COVID-19's fifth wave, driven by the Omicron variant, brought with it surging case numbers and record hospitalizations in Alberta. However, in recent days, as hospitalizations have plateaued and case growth has slowed, there's been growing talk around lifting some of the public health restrictions in place in the province. On today's episode of Under the Dome, we'll discuss the current situation in Alberta hospitals and why caution may be required before moving to those next steps. My guest today, Dr. Lynora Saxinger. She's an infectious diseases doctor at the University of Alberta, and Dr. Shazma Mithani. She's an ER doctor at the Royal Alexandra Hospital and the Stollery Children's Hospital in Edmonton. Both of you, thanks very much for joining me today. So I did want to talk a bit about this move to remove restrictions that we're seeing in some countries around the world, and you're seeing a push for it here in Canada. But first, I wanted to give our viewers a bit of perspective around what the situation is kind of on the ground. Dr. Mithani, you're in the ER at a couple of busy Edmonton hospitals. What are you seeing in terms of, patient load, COVID patients, even we've heard a lot about burnout in the healthcare sector, even doctor and nurse burnout. What is the situation for you on the ground?
So the situation is quite stressed on multiple fronts. So as you kind of alluded to, we are seeing quite an increase in volumes in our emergency departments across the province. I can speak to Edmonton in particular because that's where I work. In terms of both COVID and non-COVID patients, so we're seeing added and ongoing pressure of both COVID and non-COVID patients coming into the emergency department, who are then requiring admission, who then have to be kind of occupying a hospital bed in the hospital. And so there's added pressures upstairs on the wards as well because of that. And then you kind of alluded to the burnout factor as well. I mean, I don't think that my colleagues and I, nurses, doctors, respiratory therapists, unit clerks, have been ever as burnt out as we have right now. I mean, we've now suffered previously through 4 waves of this pandemic, and now we're on our 5th wave, and we're just worn pretty thin with the highest volume wave so far, and it's becoming a challenge to go to work, to function appropriately, and to continue to care for this large volume of patients that we're seeing.
Mm-hmm. And Dr. Saxinger, as has been mentioned, we are having record numbers of COVID patients. I think we were up to 1,600 on Wednesday, the day before we recorded this. We're seeing creeping hospitalization cases, and even Premier Jason Kenney has talked about the need to see those hospitalization numbers come down in a steady way before we can start talking about removing restrictions. Is that why in places like Alberta and other jurisdictions in Canada, we're not quite at that point compared to the UK and Ireland and Denmark and other countries that have made those moves?
Absolutely. I mean, I think that you have to look at the timelines. And if you look at a place like the UK, they had a very abrupt, very, very high Omicron peak. And it started coming down quite quickly. I think there's been a lot of pressures to have restrictions removed. But if you looked at what's happened since they actually let up on their restrictions over the last few weeks, although the case numbers have continued to be okay, they've kind of plateaued, the hospitalization numbers have been sustained in a really high way. And so to me, that's a bit of a red flag that if you go too fast, you're not really letting your healthcare system decompress enough to be able to get back to normal business. I mean, I'm on the COVID ward right now. It's very, very busy. I think that the impact throughout the healthcare system is very visible right now, and I just can't see us running at this rate for much longer. Like, I really think that would be an undoable burden, and we really haven't seen this kind of volume for the entire pandemic. And so it seems a bit almost disconnected to say, well, the overall case numbers in the community aren't that bad, so let's really reduce restrictions, when all along the healthcare capacity, where we want to be able to do all the things we need to do for everybody, not just COVID patients, has never been as strained as it is right now. So it just is a real disconnect to me that people are rushing when that outcome, that hospital capacity outcome, really isn't there yet.
Mm-hmm. And Dr. Saxinger, what were your thoughts? On Tuesday, we had the Premier come out and say, we're not at a position where we can lift restrictions. It may be later this month. I know previously he had said March. We need to see these hospitalizations come down. I imagine that for you and Dr. Mithani, that people in the healthcare system, that was a positive signal. But then, in the intervening days, we've heard some moderation of that framing, whether it's, maybe later this month or maybe in the coming days. Like, what is your take on where the province could be heading and why we maybe need to hold off?
Well, I think that there is some kind of signaling of other pressures that might be at play. And I think there's also, honestly, a fair amount of uncertainty as to what we expect to happen with the current case numbers and the current hospital numbers. The combination to me does read as a bit of a yellow or red flag that, there might be some pressure to reduce restrictions more quickly. But on the other hand, I think that there's so much risk associated with that I would hope that that would not be a palatable political alternative. Because honestly, if you look at what's going on in the healthcare system right now, people with any number of health conditions will be experiencing strained care for the foreseeable future. And I don't think that that's an appropriate thing. I don't think that's appropriate for the population of Alberta, and it's certainly not appropriate for the healthcare workers and the healthcare system, because it's just too much right now. So I'm hoping that those signals do not actually translate into changing things in a hurry. I think that it is reasonable to plot ahead and to give people hope that yes, we will be lightening things up. I think it's very reasonable also to actually even give some parameters. This is what we will be looking for. But I really don't like this kind of idea that we've been seeing in some jurisdictions where they set a timeline as a kind of, I guess, point of hope in the future. It's very hard to dial back from that. And I think we do have to be able to adapt to the evolving data, including experience elsewhere.
Yeah. Dr. Mithani, one of the things that we've heard through the Omicron wave is that, individual cases, especially in the vaccinated, are particularly mild compared to previous waves, but the community-wide impact of this wave is actually not as mild as people are suggesting. What is your concern around that narrative, the idea that Omicron is mild, and how is that played out in hospitals in Alberta?
So I think it's really important to note that words matter, right? So when we use words, when we use words like mild, when politicians and leaders use words like mild, it sets the stage in terms of how people are going to act and how individual decisions are going to be made by Albertans and by their families. Yes, it's less severe. I don't think there's any arguing that. In general, it's less severe. However, because it's so transmissible and because we're seeing such a dramatic number of cases, even a tiny percent of a huge number is a significant impact on the healthcare system. And that's certainly what we're seeing in our emergency departments and in our hospitals. And so, yes, we are seeing people who are still requiring admission because of complications of being infected with Omicron, especially those who are under vaccinated or unvaccinated. And so it is continuing to be a stress on our healthcare system. And unfortunately, that messaging is being diluted by this narrative of it being mild, and giving people sometimes a false sense of security, I will say, because we are still seeing dramatic impacts on what's happening with our healthcare system as a result of how many cases we're seeing with this.
Mm-hmm. Dr. Saxinger, what are your thoughts on this debate around, mild versus severe at a community level, now that we're kind of at the point where the Premier suggests that hospitalizations are plateauing, but obviously we've reached a fairly troubling point in the healthcare system?
Well, I mean, plateauing at a unacceptable level is still not good. A plateau needs to be followed by a decrease to a more acceptable level for it to really make a difference to the lived experience of both patients and healthcare workers. So, I mean, a plateau, I think, is kind of a guardedly positive sign, and really, people have to remember that every wave that goes up, there's just as many cases on the way down. So there's a lot of people yet to be hospitalized during this wave. The other thing I was going to comment on is the idea of both community impact and personal impact. I mean, many of the patients I've been seeing this week are surprised that they're sick. Like, they're genuinely surprised that they're sick. Even the unvaccinated ones, where I think the messaging must be a little bit bent out of shape, because we know that this is still COVID in the unvaccinated, and that people who are relatively young, like in their 60s, 50s, who don't have that much by way of a health history, are getting dreadfully, dreadfully ill, and they're shocked. And I don't think that should be a shock. So there's some messaging problems there. The other thing is that people, I think, are underappreciating that, if you have a lot of health problems, even if you've been vaccinated with 2 doses, you could still end up very sick in hospital right now. And so I think that individual risk assessment has also gotten a little bit, I guess, blurred in the public eye. And it's very important for people to know that, because protective behaviors as we come down from this wave are going to continue to be important, so people don't become one of the sick ones as we come down.
Yeah. One of the things that has kind of struck me, and Dr. Saxinger, I know you mentioned it on Twitter recently, is there's this ongoing debate around, people who fear the virus and want to have lockdowns, and people who fear the vaccines and don't want to be forced to do something that they're afraid of, and how it becomes like a disingenuous, entrenched position. As someone who follows the science on it, who works in the healthcare field, what is your take on the fact that people have become so polarized on a fairly complex medical issue?
I think that it's really put us in a terrible position. If I was going to identify the single worst challenge that we face, or the single biggest challenge we face, it's because the pandemic keeps changing. The science is evolving, and yet people are settling into positions and not really acknowledging either of those two things. And it's becoming a situation where the silos, if I can put it that way, are not likely to be able to adjust to adapting circumstances. And this is a giant chess game where the virus makes a move, the pandemic makes a move, and we have to make a strategic move. And it's wrecking our ability to make strategic moves. And, we have to keep on learning, and we have to keep adjusting as things are changing. And this is really messing it up. I think it's actually kind of uncovered, I think, a lot of societal issues in a way that's really much more apparent than it's ever been before in modern history.
Yeah. Dr. Mithani, what are your thoughts on that? And how are you seeing that play out even in giving patient care and the response from patients?
Yeah, absolutely. I'll build on what was said there in terms of, this evolving virus, this evolving pandemic, and this evolving situation. I think it in people who are already a bit mistrusting, or maybe not buying into the pandemic and into the virus, and following the science as much as they should. As things change, it, I think, unfortunately breeds that mistrust in people, right? And then it makes people question, well, if this was the case before, why is it changing now? Without kind of critically thinking about the fact that, yes, viruses do change and things do evolve, and we learn more information about things and adjust our measures and adjust our behavior appropriately and accordingly. What I'm seeing in terms of patients that come in, like Dr. Saxinger mentioned, it's this shock when people come in with COVID and come in sick with COVID, this sense of surprise of, oh, I thought it was just mild. How is this happening to me? At fear as well, right? Fear in terms of what the consequences are of decisions that they've made up until this point, and then being sick with COVID. And then some people who, end up having, thankfully, less severe disease. And that kind of situation just entrenching them further in their views of, well, see, this wasn't so bad after all. And all of you healthcare workers are lying. The mainstream media is lying. And I've certainly seen that extreme in front of me at the bedside as well. And those ones, of course, can be quite challenging, but we are still seeing, not insignificant number of patients come through who still have that viewpoint, even after having contracted COVID themselves and having symptoms and needing to at least have an emerge visit for that.
Now, we're seeing more and more talk of wanting to see restrictions lifted, wanting to see, get rid of the vaccine passports, or getting rid of vaccine mandates in certain places, or mask mandates. From a health professional's perspective, what point do we need to get to be able to lift those restrictions? Dr. Mithani?
I think the most important thing here is that we should not rush anything, right? I can tell you, I understand that people are very tired of this pandemic, or very tired of the measures that are in place, and really want to move towards getting back to normal. I think that the biggest risk of preventing that from happening is rushing through this too quickly. We've seen with previous waves, second, third, and fourth wave, if we rush the lifting of measures, we see a rebound in cases and then the start of another wave. And so I think if we want to do this right, we need to make it a science and evidence-based process that has clear thresholds for when measures will be lifted, and has to be done in a controlled and slow fashion in order to be able to react to those changes. If we drop the restrictions exemption program, for example, we need enough time to see what effect that's going to have on cases, what effect that's going to have on our already stressed hospital system before we then move through to the next step, and whatever the next step might be in terms of removing restrictions. We need to do this in a slow and measured process, so that we can react accordingly and not kind of end up in a situation where our cases jump back up and our hospitalizations jump back up again.
Mm-hmm. And Dr. Saxinger, from your perspective, is there a threshold in terms of either ICU admissions or hospitalizations, total cases, that you'd feel comfortable with the province lifting certain restrictions, or is it, a wait and see approach at this point?
I think that it should be possible to have, some guidance as to what the threshold might be. And I think toggling it off the hospital admission, or the current hospital census makes sense to me, because that's really the thing that affects all of the downstream everything in terms of what else we can do within the healthcare system. And right now we have a great number of extra wards open with COVID patients. And, some of them are actually very sick with COVID. Some are less sick with COVID, but require hospitalization for any cause. It actually doesn't matter which it is, because they are in the hospital and they need to be in the hospital. And so because that to me is the kind of point that we really need to be careful about, that's the point that we should actually toggle off of when we're looking at reducing restrictions. And we should be able to hopefully see what's been happening in other jurisdictions that are a little bit farther ahead than us, and see how, when they've removed restrictions, what that's done in their population and in their healthcare capacity. Because, there's a few yellow flags here that, yeah, we shouldn't necessarily do everything at once. But, you can start down that path, but you have to be willing and clear that you might have to change things again depending on what happens. Now, one thing that I haven't heard as much about, which I also think is key to kind of emerging from this wave, is the push for maximal vaccination. So a lot of people are 2-dose vaccinated, are eligible for third doses, and that's not going that quickly. That would make a big difference. That will improve our population resilience right now. It'll improve individual safety right now. And for some reason, I don't really see that front and center as much as it should be. So if people are like, well, feeling comfortable because they're 2-dose vaccinated, that reduces your risk of hospitalization by maybe, 50 to 60%. That you can do better. You can do better than that. And so I think that has to be highlighted more in all of the communications, because from a week or two after that vaccination, you're much more protected. And that is a benefit for you and for everyone else. And so that's the other piece I'd like to see kind of getting a little bit more attention.
Yeah, and I know that's something that hasn't necessarily been talked about. I know that I've seen the government in the past suggest, if you can't get vaccinated, you should. But even this week, when there was talk of lifting regulations, that wasn't kind of front and center. One last question for both of you, and we're going on the third year of this pandemic. We're just past the second anniversary of the first confirmed COVID case in Canada. It's kind of become, in a way, entrenched in the psyche of society. We're used to dealing with these things, for the bulk of people, we're used to taking precautions. We're used to kind of thinking about it. How do we move a whole country from a defensive position against a pandemic virus to the endemic stage? Is that something that we're not at a position to really even think about now, because we need to at least get through this wave, start slowly reopening, and then start worrying about, well, okay, now we're just going to live with the fact that COVID is kind of here?
I can take a crack at that, because I think that the word endemic has some specific meanings, but the way it's being used is also kind of specific. And so when people are talking about the endemic stage, I think that what they're envisioning is that, we're not necessarily doing specific things to reduce the risk of COVID infection anymore. But what is important for people to realize is that endemic actually really just means that it's around. Yeah. And that it's not climbing. Now, it can be around at a high level or around at a low level. And that set point is still influenced by what we do, including vaccination and all of our protective behaviors. And so I think that the endemic stage might mean that we're not going to see widespread societal interventions as much, but that a combination of, ongoing staying on top of vaccination and individual protective measures that you might choose to do all the time, or it might wax and wane depending on what's going on, might be the new normal. And that I don't think people should be thinking that it's going to disappear and it's just going to be normal again. The other thing I think that's really important for people to keep in mind for an endemic state, which I do think is going to be on the horizon in all likelihood, although I think that COVID can always prove us wrong, but that doesn't mean that going back to normal is optimal, because we should be applying the lessons we've learned in a whole bunch of different arenas. And we have to make sure that we have better infrastructure to do surveillance, to make sure that we're doing appropriate testing, to do the appropriate public health and infection control supports. And so, to me, there's this whole build back better idea that goes with an endemic state. And there's also this idea that you want the endemic state to be a low endemic state, because, we accept seeing epidemics of influenza, RSV, to common viruses that can be severe in healthy people every year. And every year the hospital sees a bit of a crush related to those two viruses. We're going to have COVID as part of that mix, likely, and we don't know the pattern yet. But we do have some ability to influence what that looks like and to minimize potential harm. It does mean that your everyday existence would be much more normal, but I don't think it would be the same as it was before.
Yeah. And Dr. Mithani, from your perspective, is setting the healthcare system up for success in the future part of it, either the ability to ramp up capacity as needed, or is it a case of needing to have a better baseline capacity in hospitals so we're not in a crunch when these kind of things roll around again?
I think it's a mix of a few different things, right? So, as a physician in general, of course, prevention is the best, right? We want to make sure that all of the systems are in place to kind of prevent people from coming into hospital to begin with. So whether that be making sure that everybody has access to a family doctor, making sure that vaccines are an important part of that conversation, making sure that this new normal includes just general safety measures in general, a new way of thinking about how to protect yourself from whether it's COVID or other viruses. There's that piece of it. And then in terms of the hospital system, yes, there are lots of different things that we can do to improve things going forward. I think that there's a level of reaction that always needs to be built into the system. But if we do things right in preventing people from coming into hospital to begin with, that reaction can be less, and it certainly doesn't have to be as dramatic in terms of like what we've seen during this pandemic, and the need, the requirement to ramp up ICU spaces and ramp up kind of unconventional non-ICU acute care spaces as a response to these rapid rise in cases. So I think it needs to be a multifactorial approach that will improve the healthcare system going forward.
I appreciate all of your insight and all of your hard work as we roll on with seemingly endless amount of cases and hospitalizations. Dr. Mithani, Dr. Saxinger, thanks very much for your time.
Thank you.
Thanks for having us.
That's it for today's episode of Under the Dome. Don't forget, you can find all past episodes at edmontonjournal.com/underthedome, or you can hit that subscribe button on YouTube. I'm Dave Breakenridge. We'll see you next time.